We're looking at assessment for scoliosis. Thus, a patient came and you're suspecting that the patient has scoliosis. How can you be able to access the person and confirm that the person has scoliosis? Do you understand? So we have the standing assessment, then we have the forward bending assessment. Forward bending assessment, I think, is also known as the Adams something. Okay, Adams test, or you could say the Adams forward bending test. So clinical assessment of scoliosis, is you are trying to look at what the inequality, of the two sides of the back. The condition will cause one side to be what higher, one side will be what lower. So you use the standing assessment and also the forward bending test, because scoliosis is a three-dimensional deformity of the spine that becomes more evident when you do this two maneuvers. So standing assessment is simply the patient will stand upright, and you can clearly see that you look at the shoulder is one higher and one lower. You look at scapular prominence. You look at waist asymmetry. Pelvic tilt on one side. Spine curvatures. Okay. So you access the sagittal profile for kyphosis or lordosis, and leg length discrepancy is one leg higher than one. You understand? See it. So forward bending, yes, is also known as the Adams forward bend test. So the patient's position, the patient will bend forward at the waist, arms will be hanging freely down. Okay. Now you look at behind for all those rib long, or lumbar prominence. This occurs because of vertebral rotation or a hallmark of structural scoliosis. So if you have structural scoliosis, there is rib hump or lumbar symmetry. Then postural scoliosis, the scoliosis will disappear probably after the person stands or so, but the person do a forward test, it will appear. So that's it for these two ways to access and confirm that the person has scoliosis.